I'm a social worker at a large public hospital. And there is many reasons why we might meet. It could be that you've just been diagnosed with cancer and you want to talk about what this means for you, for your family, or maybe somebody you love has just passed away and you want to talk about what comes next. How do you even go about planning a funeral? It could be any number of scenarios that bring us into contact, but for whatever reason, it's likely that you're having a really tough day. The thing is, as a social worker, we might get 5 to 25 referrals a day, and it can be really overwhelming trying to decide which patient you'll see first. Will it be the patient who's been waiting the longest, or the patient most at risk? What about the patient who the doctor is demanding you go see? This is where my research comes in. I'm hoping to solve this problem by creating a prioritisation framework. To do this, I'll firstly interview social workers about how they're currently deciding which patients they see first and what factors they consider when doing so. I'll summarise these interviews and then present them back to the social workers so that through multiple surveys we can gain a consensus of what factors are integral to a prioritisation framework. Creating the framework in this way with the social workers will make it more relevant, more user-friendly, and more likely to be used in practice. So the framework will help social workers decide which patient to see next, but it'll also make decisions more consistent and transparent, and this will help other healthcare professionals have a clear understanding of when their patient will be seen by a social worker. Overall, the framework will help with better resource allocation, meaning hospital resources will be directed to the patients who need them most, and social workers can get on with supporting people through their toughest days.